you're still watching TVC Breakfast. It's World AIDS Day today with the theme Getting to Zero and AIDS by 2030. I'll give more highlights on that theme later on in the course of the program. The United Nations has a strategy to avert 21 million AIDS-related deaths, 28 million new HIV infections, and 5.9 million new infections among children by 2030. Here in Nigeria, an alliance of non-governmental organizations, that's NGOs, and known as the Red Ribbon Coalition, is embarking on a 4-day nationwide outreach to reach more than 3.5 million Nigerians with key HIV messages. That's quite interesting. I have two young men here in the studio. We're going to be looking at this topic. To my immediate right, I have Koya Damilola, who is a Center Coordinator for Youth Friendly Alimosho. Glad to have you this morning on sir. TVC Breakfast. And then to my extreme right, I have George Mbam. He's a Counseling Coordinator. Interestingly, MadamFelicia.org. Maybe I should start with you, George. What is MadamFelicia.org about?
Okay, so MadamFelicia.org is an online counseling platform. Basically, what we do is we create an anonymous kind of platform where people who have issues, that are bothering them, could come to that platform, and then anonymously you will have a counselor that attends to you and then tell you what you need to do. It's like an online coaching platform where people who have health issues, relationship issues, sex issues, and then maybe you have one or two symptoms and you don't want to maybe go to a doctor to talk to a doctor. We have a network of doctors, we have a network of counselors, you have sex issues, sex complications, etc. So this platform opens up for a network where you can meet counselors, and then these people, you just ask them these questions and they respond to you.
Well, today is World AIDS Day. How does that particularly connect with today? I mean, today's issue.
Okay, so today being World AIDS Day, Madam Felicia is partnering with Youth Friendly. Youth Friendly is an AIDS organization, HIV and AIDS organization. So basically what Madam Felicia is doing is trying to basically we are putting up a program that we are bringing different youths from about 25 schools. These youths, we are trying to create awareness for HIV and AIDS, and then try to try to make them see people who have HIV/AIDS should not, live with that stigma. People who have HIV/AIDS should be able to come out openly and then, just say it, and then try to make them see people, not to see people who have HIV/AIDS as though that they are dead or something like that.
The world is ending.
Like the world is ending. You understand what I mean? So the whole theme is that we want to try to reduce that stigma that is with HIV/AIDS to a point where when somebody is with HIV, you see him like somebody who has malaria, Okay. So, but in that extent, what we are trying to do is we are trying to reach out to youths, because that is what the platform Madam Felicia is for. We are trying to reach out to youths. We are trying to reach out to people who are in relationship. We are trying to reach out to people who indulge in sex. We are trying to reach out. So basically, we are trying to use this channel to bring them in and then talk to them about HIV/AIDS. Talk to them about what issues could arise from having premarital sex. What issues, and then so basically how you need to avoid it. How you need to have safe sex, etc., etc., etc.
All right, Koya.
Okay,
you are the coordinator, Youth Friendly Alimosho. Alimosho is somewhere in
that's
Ikotu. Okay,
yes,
okay, right, okay. Youth Friendly. Let's talk about that, and we'll go down to talking about how you're coordinating all of this.
Okay, sir. Youth Friendly is the reproductive health units of the State Ministry of Health.
The State Ministry of Health?
Yes, sir.
Reproductive state
adolescent, yes. Adolescent
of
and
Lagos
youth.
State
Yes.
Ministry of Health?
Actually, Youth Friendly is an international project
Okay.
brought into Nigeria by Compass some years ago, and it is in virtually all the countries of the world. And currently, is being funded and managed by UNFPA, and is in all the states of the Federation. But in Lagos State, we call it, all over the nation is called Youth Friendly, all over the world is called Youth Friendly. But in Lagos State, we call it Hello Lagos.
Hello.
Yes, Hello Lagos.
Hello, Lagos.
Yes, because Lagos State is distinct.
It's
Lagos
distinct.
yes, Lagos is different. So we decided to call it
City of Excellence.
Yes, sir.
Okay.
So
Hello,
we decided
Lagos.
to call it
Hello, Lagos.
So that's our slogan. But it's still called the Youth Friendly,
Friendly,
because it deals with issues relating to youth and adolescents.
Okay, I'm so much interested. This is interesting, but today is World AIDS Day. Just like I asked George,
Yes.
what's the connection with Hello Lagos, which of course is youth friendly,
Yes.
with today, what the world is about today, which is World AIDS Day?
Okay, from our survey, we've discovered that majority of those who are infected with this HIV and AIDS are mainly adolescents, youth,
Okay.
to be precise. And Youth Friendly being the health unit, also we carry out medical tests, we talk to people about their health, and because it's the reproductive health unit, you cannot do away with issues relating to HIV and AIDS, because the major means of being infected is through sex. And there is no way you tell you that you're infected. Some of them will tell you that I've never had sex, then we can start counseling. Okay. So in Youth Friendly, we do counseling, we carry out HIV tests, we do so many things.
Okay, this one is not online.
It's not online, no.
People have to deal with
sir.
you directly.
Yes, sir.
Okay, I'll get back to you. Just like George was talking about the fact of trying to either get people to be open. How successful are we getting with all that? Because AIDS is still something like an anathema, it should not be. That's what the world is about. But I'll get to that. I have Kemi, who is joining us now live from Abuja. Kemi, glad to have you join us this morning on TVC Breakfast. We have the theme of this year's World AIDS Day, Guessing to Zero. Zero new HIV infections, zero discrimination, zero AIDS-related deaths. What's happening in Abuja about this AIDS program? What do you have for us from Abuja, where you are?
Yeah, good morning, Indy. Here in Abuja today, we're actually going out for counseling, testing, and treatment. And we're going to rural areas, some rural areas within the FCT, where there will be a lot of testing done. There will be a lot of counseling for those who are tested and probably found out to be positive. And then there will also be treatment for those who are already living with HIV and AIDS. And as you know, this year, the theme is getting to zero, eliminating AIDS by 2030. And most of the stakeholders that I have spoken with previously have actually said they are happy that the AIDS prevalence rate in Nigeria has really dropped, and by 2030 they are actually sure that AIDS would have been reduced to its barest minimum. Now, so far we have about, in sub-Saharan Africa, of course, we have about more than 23 million people infected with HIV and AIDS, and of course more than about 2 million deaths yearly on an annual basis from HIV and AIDS. And most of the time, a lot of causes for people not getting enough counseling or treatment is stigmatization. Like the guests were saying earlier, a lot of stigmatization still exists between people who do not or are not aware of this disease and how it is transmitted or how it should be treated or handled. So most of the time, a lot of people do not get treated because of the feeling that they will be stigmatized or people will not, come close to them anymore. So that is one of the key issues that stakeholders are talking about, and how they will be able to find a remedy to curb the spread of HIV and AIDS, and also to find treatment. And a lot of to find proper treatment plans for those who are already living with the disease. Now, for this year, of course, it's cheering news for all of them, because there will be walks, there will be talk shows, there will be a lot of awareness and campaign on the streets of Abuja. I know the UN is doing something, NACA of course is doing something, and a lot of NGOs around the Abuja center will also be taking walks. And most times on these walks, what they do is to give out flyers, to raise awareness, to keep talking to people on the streets, to continue to raise that the fact that HIV and AIDS is real, but then there should be no stigmatization. In order to be able to cut down the spread of HIV and AIDS, we need to raise more awareness for people, especially in Nigeria, because Africa actually has the highest number of people living with HIV and AIDS, and Nigeria is second, is second after South Africa, which has the largest numbers. Other countries like Botswana, Lesotho, they are actually fighting this scourge, and actually they have so far been able to reduce their own numbers because of the kind of plan they have. And the approach that we have in Nigeria is actually called the fast track plan, whereby most of the NGOs and stakeholders who are involved in actually raising more awareness for the campaign are using more approaches to bring to find more healthcare centers, to provide more facilities, more healthcare workers that are working with people who are actually living with HIV and AIDS in the country.